Hello and welcome back to the Thought Leader Recruiter podcast. I'm Sam Bylett and today I'm joined by Karolina Willis, CEO and founder of Intercare Recruitment. Karolina, welcome to the show.
Thank you for having me.
It's good to have you here. So let's kick things off. Can you share what Intercare does and what led you personally into international healthcare staff?
What we do is we provide healthcare professionals to hospitals, healthcare organizations across the globe. I started my career in the NHS in the UK. I always liked international traveling from the day I was born. I thought, traveling and learning new culture and new countries will help me later on in life. And I was born in Poland, moved to UK when I was a teenager up in the UK, and from there I started traveling across the world, and that's how I started Intercare, and I decided to do international recruitment.
Yeah, makes sense. Sounds like you've had a interesting career so far.
Yeah.
So what types of healthcare providers do you usually work with the most?
So we provide physicians, national nurses, as well as domestic nurses, healthcare, non-clinical administration staff as well. So anybody that can work in healthcare organization. So from medical staffing and up to CFO, CEO of the hospital.
Okay, makes sense. I see a stat the other day. The World Health Organization is forecasting a global shortfall of 10 million healthcare workers by 2030.
Yes.
Are
Yeah.
you already seeing the effects of that with your UK and EU clients?
Yes, we're seeing shortage of nurses is growing. Unfortunately, the access to healthcare is limited in many areas of the UK and Europe. What I've noticed recently in the past couple of years, a lot of international nurses, for example, they don't want to come to UK due to high cost of living. The salaries are very low, so they're trying to go to either the Middle East or United States for better life opportunities. So definitely the nursing shortage as well as physician shortage is growing in the European market. I've seen a lot of changes.
Yeah, and how are you and your team kind of helping those hospitals manage that gap right now?
Yeah, we again are going internationally. We're going to get nurses from other countries, from Africa, from the Philippines, Asian countries, from India. So we're trying to fill those gaps as much as possible. But it is a struggle at the time.
Yeah, sure. And beyond the kind of shortage itself, are there any other patterns showing up? Like, is there any changes in visa policies, onboarding challenges, or retention struggles?
Yeah, definitely the immigration has been more restricted recently in the US and even in the UK. For the nurses as well, the licensure is not as easy to get for UK. The length the time is very long to get the license in the UK comparing to 5 to 10 years ago. So there are some restrictions with traveling and especially on the immigration side.
Yeah. And the job market is obviously very intense at the moment. How are
Yeah.
you kind of helping your international nurses and healthcare professionals stand out when it comes to taking that interview?
We really engage with our candidates. All our recruiters are engaging with the candidates, with their families, spouses. It's a big change for them when they have to change countries. So it's very important to keep that relationship and trust. We build a good trust at the beginning, creating a foundation in the relationship so they can trust us in the process. I'm an immigrant myself, and I always rely to their opportunity. I had the opportunity to move countries, and I want to do the same for these nurses. So they're kind of building the trust at the beginning, and from the trust, building the relationship, they're giving us a lot of referrals.
Yeah, for sure. And are you noticing more hospitals improving their compensation packages quietly to stay competitive? How much kind of active headhunting is happening in the space?
I've noticed more and more hospitals giving like a sign-on bonus to attract these candidates. They up a little bit the hourly rates, or they're giving more attractive packages, health insurance or pension, private pension. So I've seen that trend of they have to do it because the shortage is growing, and they have to come up with something to attract these candidates, because the competition is it's big. It's very competitive market, and we helping our clients to come up with a solution and strategy how to attract these candidates.
Yeah. And what's one of the biggest mistakes you see providers make when they first start recruiting from overseas?
The biggest mistake is not preparing their internal team about the international recruitment process. So that's been our biggest challenge. Like the internal recruiters, they don't have enough knowledge on how to recruit international nurses. So I think that's the biggest mistake, that the leadership is not allowing them to kind of do the work on the process. We come in, we guide them, we support them, we advise them how to do the process for international recruitment. But I think that's the biggest issue for many of the organizations when they go into international recruitment. And not enough research. They're not doing enough research. They not aware about immigration. So again, we come here with the immigration support, with the recruitment support. Our recruiters are nurses themselves, so we already have that medical knowledge and skill sets to recruit nurses and medical staff.
Yeah, it sounds like it's a huge task and so much to think about when
Yeah.
recruiting from different countries around the world, and
Yeah.
for the candidate as well. It's such a big move, isn't it? Like moving to a different country.
Yeah, it's huge.
Yeah,
We're changing their lives,
yeah,
and that's what I do. I'm trying to change their lives for better, to give them opportunity. And yeah, it's a big task. It's a huge amount of time involved in the process, and we all have to communicate. I think the biggest challenge in this process is the communication as well.
yeah, for sure. Healthcare organizations don't always prioritize employee branding, but when you're trying to attract clinicians from abroad, what does a strong brand actually look like?
So I don't think the branding is as much important as the commitment from the employee, from the employer. Um, how they will be treated. Do they have orientation or training implemented? That's what the overseas candidates asking for. They're not really asking for the name of the facility. They want to be treated with respect. They want to have full training on board and feel supported. Many times they traveling on their own, so they feel lonely. So they looking for that support and comfort when they arrive to different country.
Yeah, that makes sense. And we've obviously seen a lot of tech adoption in healthcare recently, digital onboarding, VR simulations, and AI for scheduling. Are hospitals adapting fast enough to keep up with this?
Not yet. I've not seen much changes with the AI and hospitals. I think on the administration side, it will be great to have the AI access. But healthcare is all about human touch, and I don't think it will ever be fully transformed to AI. Because of that, healthcare is all about helping people. So having that human touch, it will never disappear. But yeah, there are some hospitals that implementing AI. I've seen a few hospitals, for example, in Asia, where they implemented a robotic nurse. In the United States, they're doing the telehealth. In the behavioral health, you don't really have to have on-site physician. So yeah, it's helping in one way, but I think you still need that connection, person to person.
Yeah, yeah. I think we're probably a long way off yet from robot doctors.
Yes. Yeah, I don't think I can trust a robotic doctor at this moment. Maybe in 30 years' time, yes, but not. I don't want to be the guinea pig.
No. When a nurse is feeling stuck or say getting passed for interviews, where do you usually start? Is it helping them with their resume? Is it certifications, networking?
Yes, so we screen these nurses, we review their resume together. We engage a lot of time with nurses, their families. Sometimes we arrange a call together with the family to really walk through the opportunity, the community, where they're coming to, what city, if they are in a school. So it's really full engagement about where they will be working and who they will be working with.
Yeah. Yeah, makes sense. And obviously, pay transparency is another big topic. Are your clients being open enough about salary ranges, and how do candidates know what's fair to ask for?
Yes, yeah, we always work with the clients. We guide them through the process and the salary ranges. Again, depending what area they are based, how many years of experience the nurses have or the physicians. So we try to negotiate on behalf of the candidates and guide the clients as well. If it's too low, we will let them know that this is a little bit too low. This is what we have to do in order to attract the staff. Yeah.
And what's your advice for, say, overseas clinicians trying to find a good recruitment partner, and how can they tell who's, say, legitimate, and who's to avoid?
Definitely number one is they should never pay an agency to start international process. Unfortunately, there are many agencies that do that and frustrates me because this shouldn't be allowed. The full process, the immigration process is always covered by the sponsor, which is the healthcare organization. So they have to be looking at well-established companies. Our company is not huge, but we more kind of type of concierge type of service provider consultancy. I have 20 years of experience in this. I have many connections that I established 10, 15 years ago. And till today, we are in communication. And most of our candidates come from referrals because they trust us. And the difference between our agency, for example, and others, we have that international experience. I have obviously myself been traveling the world, and part of our team, our recruiters, they also have that international experience, so the nurses kind of trust us in this process because we've done it ourselves.
Makes sense. And looking out, say, for the next 3 to 5 years, what big shifts do you think will reshape international healthcare staffing?
I hope the immigration will ease off a little bit, so we can have better access to certain visas in healthcare. I know the UK and Australia and Middle East, they have designated healthcare visas. Unfortunately, the United States is still a little bit behind. So I hope that will change. And the life work balance opportunities as well. At the moment, I think a lot of nurses are burnt out. They're working overtime, and I hope that will change by bringing more international nurses and will give a better healthcare access.
Yeah. Okay, makes sense. And what's next for Intercare Recruitment? Is there anything exciting in the pipeline happening? Are you planning to expand into any other countries at all?
Yeah, we just started our expansion to Singapore and Australia. We are getting clients established in those two countries. We have presence already in the Middle East, so Singapore next and Australia.
Exciting stuff. For our audience, how can they find out a bit more about Intercare Recruitment and how to connect with yourself?
I'm available 24/7 on LinkedIn. We are on social media. I do like to attend conferences on a global scale, so I'm reachable pretty much everywhere on social media as well.
Okay, perfect. Well, thanks, Karolina. It's been a great conversation. Really enjoyed it, and speak to you soon.
Thank you.
Thank you.